Good evening. Nashville General has long been the city's hospital for the poor and uninsured. The facility provides medical treatment whether the patient has the money to pay for it or not.
But tonight there are new questions about whether the company that runs Nashville General's ER has been overcharging those who seek care there. News Channel 5's Investigates Jennifer Krause looks to answer those questions.
Nashville General treats some 50,000 patients a year. Many are poor and have no health insurance. And now a new class action lawsuit alleges that patients at hospitals across the country, including Nashville General, are being seriously overcharged for medical care.
Team Health is executing a scheme to squeeze as much money out of patients as it possibly can.
Ben Harrington is one of the attorneys working the case, and Team Health is the Knoxville-based company hired by hospitals, including Nashville General, to run their emergency rooms and provide the doctors to staff them. Team Health then bills the patients for the hospital visit. But according to the lawsuit, these bills are often substantially more than the going rate. And Team Health fraudulently inflates its rates far above what it is legally entitled to collect.
And it's asking patients to pay that full amount. And when patients don't pay it, Team Health's practice is to file lawsuits to seek recovery of that amount. I think it's in the last 3 years alone, Team Health has sued almost 5,000 patients to recover artificially inflated bills.
And many of these patients, the lawsuit maintains, qualified for free care and reduced rates through charity care programs. Here in Nashville, we searched court records and found just last year, Team Health, through its subsidiary, Southeastern Emergency Physicians, sued more than 700 patients who'd been cared for at Nashville General. Those we were able to reach told us they had no insurance when they were treated, including a woman we found who was billed more than $3,600 for 4 hospital visits. Court records show she makes about $600 a month, while her living expenses are more than double that. Yet she was ordered to pay $40 a month to Team Health and will be for the next 7 years to pay off that debt.
That's a typical case.
Attorneys accuse Team Health of putting profits over public health. They say the company, which is owned by a private equity firm, is more focused on paying shareholders than providing medical care. And patients, they say, including those at Nashville General, suffer as a result.
When you're talking about, poor and indigent community that's seeking medical care, in an emergency, right? And they're being overbilled for that when they really don't have much of a choice about, the options in front of them. I think that's severe misconduct.
In a statement to us, Team Health said the company is confident its billing practices comply with the law and that the claims made in the lawsuit are without merit. Team Health has run the ER at Nashville General since 2016. The hospital gets almost $50 million a year from the city to care for Nashville residents who do not have insurance and cannot afford medical treatment. The hospital refused to comment on the lawsuit. We also reached out to 4 Metro Council members who represent North Nashville and sit on the minority caucus, but none of them would discuss the lawsuit with us or talk about any concerns they had that their constituents were being overcharged for hospital visits. Jennifer Krause, News Channel 5 Investigates.
Team Health also told us they've stopped suing patients from Nashville General for overdue bills. That happened after Congress began investigating surprise billing practices by physician staffing companies, including Team Health, late last year. But even though the company has not filed any new cases this year, it appears to be still trying to collect from many patients it had already sued.